All right, so today I'm going to talk to you about multiple sclerosis. So I'd like you guys to take a second and think about the last time you felt sick or under the weather. Maybe you had COVID, maybe it was the flu. But for me personally, I always feel like I'm going to feel sick forever and it's never going to end. But ask yourself how many people you might know who do suffer from a chronic condition. Current estimates actually suggest that 60% of Americans suffer from a chronic condition. So that is 6 in 10 adult Americans currently living with at least one, if not more, chronic conditions. And along with rates of these diseases on the rise, multiple sclerosis or MS diagnosis rates are also climbing. A 2020 survey estimates that currently 2.8 million people worldwide are suffering from MS, and that's more than the populations of Durham, Raleigh, and Charlotte doubled and combined. The same report calculates that someone's diagnosed with this condition every 5 minutes. So today we're going to go over what MS is and the associated risk factors, some symptoms and diagnosis and how to go about getting an MS diagnosis, and then what current treatments are on the market today and how to have the best quality of life when living with a chronic illness. Although there are numerous, today's forum will briefly review one autoimmune disease in detail, multiple sclerosis. What is multiple sclerosis? Multiple sclerosis is an autoimmune disorder that's characterized by the body's own immune system targeting its nervous tissues. So that's the spinal cord, the brain, any of those neurons, sensories that you feel in your hands, your feet. Any of that tissue can be damaged. And if you see in this picture, a healthy neuron, that myelin sheath, that blue texture is thick and nice and coated, protecting that neuron. And then the other neuron to the right, you can see what it looks like when the immune system targets those tissues and eats away at that, where that leaves the neuron exposed. The main tissues that are affected by this are the brain and spinal cord, but we have nervous tissue all over the body, so tissues everywhere can be affected. Currently, there is no known factor that causes multiple sclerosis. It is an autoimmune disorder, so we don't necessarily know the true origins, but there are a couple risk factors that can increase your likelihood to develop MS. Age, gender, family history, lifestyle choices, and ethnic background, to name a few. Morbidity rates show that women are 2 to 3 times more likely than men to develop MS. And they also show that individuals who have parents or siblings or other family history of MS diagnosis, that will increase your risk. There are also confounding risk factors such as obesity or tobacco use. So if you're a woman who struggles with obesity or a smoking habit, you're going to be much higher risk of contracting multiple sclerosis than somebody who is a man or a woman who does not struggle with those things. Again, there are multiple types of MS. Depending on the severity, effects can be debilitating and or permanent. And now that we've gone over the conditions and characteristics, we're going to go over symptoms and some potential effects. So symptoms of MS, because nervous tissue exists all over the body, do vary on a case-by-case basis. One patient can have a completely different experience from another. Mayo Clinic has compiled some of the most commonly reported symptoms, such as numbness or muscle stiffness, cognitive problems, bladder and bowel control, pain, just all phantom pain all over the body, blurred vision, mood swings. Symptoms do range. The number one reported symptom associated with 80% of MS patients is fatigue, just feeling a lot of tired and just muscle fatigue. And it is the most common symptom in patients. To diagnose MS is really interesting because there is no one single test or lab analysis that can say definitively that you have MS. According to the National Multiple Sclerosis Society, providers use multiple measures to rule out other possible conditions before collecting evidence of MS onset. Some of these include MRI imaging or spinal taps to look at your spinal fluid or a full blood count panel. The National MS Society states that the physician must find evidence of damage in at least 2 separate areas of the central nervous system and find evidence that it happened at 2 separate points in time before you'll be diagnosed with MS. So treating MS, there are a ton of different medications today on the market and a ton of different administration methods, depending on what is comfortable for each patient. You could have an oral medication, an injection remedy, or intravenous fluid meds. So that's IV treatments. According to Mayo, corticosteroids for inflammation and plasma exchange, they help decrease instances of symptom flare attacks. Additionally, there are also some lifestyle practices, such as regulating exercise and diet to keep the mobility that patients do have now, and also regulating the stress in their life, because in periods of high stress or duress, you will experience more symptoms. Yoga and other relaxation practices such as massage has been helpful too if patients aren't comfortable with talk therapy. And these practices are getting more and more information gathered as time goes on. So as I stated at the beginning of this forum, multiple sclerosis affects 2.8 million people worldwide, and numbers are still climbing. We talked about the characteristics of MS and risk factors, diagnosis and symptoms, and current available treatments. And I hope you now have a better understanding of this autoimmune disorder that touches the lives of so many. Does anybody have any questions? Okay. Stop my share.